Okay, so back to pneumonia. Um, there's three different types. You can have aspiration pneumonia, which is like it says.
I just got my vitamin water in my lungs. I'm probably going to die from pneumonia now.
There you go. That's aspiration pneumonia. You can have inhalation pneumonia where you inhale
particles like
you inhale bad things.
Bad things.
And you can have bloodborne pneumonia, which is bacteria.
Yeah,
bad stuff. So
it can be community or hospital acquired.
If it's community acquired, you would have gotten it within 2 days of hospitalization. So if you get to the hospital and you've been there for 12 hours and all of a sudden you have pneumonia,
it's not the hospital's fault.
Right.
You can't sue them.
It's community acquired.
However, if you've been on a vent for 3 weeks and you get pneumonia,
that would be ventilator acquired, which is a separate type of thing, but it would be from the hospital and hospital acquired. Community pneumonia is often caused by strep, pneumonia, influenza, that's a big one, and the pneumococcal virus, not virus.
Pneumococcal
Bacteria.
Cockle is the bacteria.
Yeah.
Cockles bacteria.
So hospital-acquired pneumonia would be any pneumonia you develop after 48 hours of hospitalization.
Which is pretty much the rule for nosocomial infections.
Yeah.
I think.
It's a good rule of thumb to know.
Yeah.
Your signs and symptoms of pneumonia would be fever, chills, chest pain, cough with sputum, you hear crackles.
Malice.
Yeah.
You don't feel good.
Yeah, you have crackles, bronchi, and ralls. You would have a increased tactile premonitus, which we'll demonstrate in a little bit.
99. That's the preview.
And it would be dull upon percussion.
I think you have to have a chest X-ray to diagnose pneumonia.
Yeah, and it could take up to 6 weeks for your chest X-ray to clear. And pneumonitis is like pneumonia. Basically, it's when they suspect pneumonia, but they don't have a chest X-ray to confirm it yet. Yeah. So you would treat the infection and treat the symptoms. So you should probably treat with ampicillin and gentamicin.
But before you treat it, you're going to want to get a sputum sample and culture it.
Very important.
Then you can start a broad spectrum antibiotic until your sputum culture comes back, and then you can switch to whatever the most sensitive antibiotic would be.
Yeah, so the Ampigent, that's a gram-positive and gram-negative antibiotic, just to kind of cover all bases there. And for people over 65, it's recommended that they get the vaccine.
Or if they live in a long-term care facility or have a chronic illness like diabetes or cystic fibrosis.
And you can get the pneumonia vaccine at Walgreens.
Hey!
Yeah.
One of the nursing interventions for pneumonia is the good lung down position. Good lung down. So, like, if I had pneumonia here, I'd want to be laying this way and it would help me breathe.
Yeah.
I read that in the book.
So good thing to know. Complications of pneumonia could be pleurisy, pleural effusion, atelectasis, bacteremia, a lung abscess, empyema, pericarditis, meningitis, or endocarditis.
Lots of items.
Yeah, so you can get a lot of bad juju from pneumonia. So now Ashley's going to talk to us about cystic fibrosis, which you got to preach earlier, and we'll finish that up.
We'll finish that now. Cystic fibrosis is a genetic condition which varies in severity. You can actually be diagnosed with cystic fibrosis. I did not know this. I think it's interesting. A lot later in life, and it isn't always as severe as when kids get it and then they die in their 17s. So it doesn't have to be quite as awful. I need to talk a little louder. So, airway clearance techniques include postural drainage, chest PT, and breathing, which is that positive and expiratory pressure breathing. And they are also giving you meds to liquefy secretions. Basically, with cystic fibrosis, you just have a ton of secretions all the time in your systems. And they obstruct your bronchioles, which leads to air trapping and hyperventilation. And then you get a progressive loss of lung tissue from inflammation and The longer this goes on, the more scarring builds up. They also have GI issues. They don't make certain enzymes, and they might have to have enzyme supplements to food. So early manifestations would be failure to grow, clubbing of the fingernails, persistent cough with mucus production, tachypnea, large frequent bowel movements, large protuberant abdomen, which might develop with an emaciated appearance of the extremities, and that is again from the malabsorptive disorder side of cystic fibrosis. There's no treatment, but there are goals for providing a better life, which we talked about earlier when we were talking about COPD. And that would be to promote clearance of secretions, control infections in the lungs, provide adequate nutrition, and manage the pulmonary problems, so relieving airway obstruction. And so, with the health history, this is where it got weird, because I was like, why would you care about their bowel movements with COPD? I didn't notice until then, because it's so similar. You're going to ask about any recent respiratory infections. If they've had a cough, sputum, to describe the sputum, any family history, dietary intolerance, weight loss, do they have large frequent bowel movements, dyspnea or activity intolerance. That's about all we have to say about cystic fibrosis. But now we're going to talk about our favorite, tuberculosis,
like MTB, muscle to bone,
muscle tendon bone,
muscle tendon bone,
muscle to bone, muscle tendon bone,
yeah.
MTB. Well, now we're on to tuberculosis, everybody's favorite. Funny story, I got fit tested for an N95 respirator, which is what you would wear if you were caring for a patient with tuberculosis, and they could not find one for me because my face is funny, so I can't take care of TB patients. I'm really crying about
and now
that.
you can make fun of Ashley
for having a funny face.
Yeah.
If you weren't already. Behind my back.
So, so TB is spread by droplet
nuclei.
Yes.
TB.
And you actually have to be in pretty close contact with the person for it to spread.
Kind of like Chris and I are.
Yeah. So if I was to cough on Ashley and I had tuberculosis, there's a good chance that she could get it. But if we were on an airplane together and she was sitting in like E6 and I was sitting in
Z10,
it would be fine.
We're on an Airbus. We were on an Airbus. That's why it's so big and there's so many running.
Oh, right. Okay. So it's caused by Mycobacterium tuberculosis, and that's often resistant to many drugs. You can look at table 28.7. I don't know what's on there. It's a surprise. I can't tell you, but
we should get the medical certificate.
You should look at it.
But then our camera wouldn't be lined up, so just look at it.
Just look at it, yeah. You can get a PPD to read. You can get a PPD to see if you've had exposure to tuberculosis before.
An important thing about PPD is they are read by touch, not by sight.
Yes.
So positive is going to be induration, that's hardening of where you were given that tuberculin, that purified protein derivative of the tuberculin. If there's erythema, it is not positive. Just because it's red doesn't mean it's positive. It needs to be indurated.
Yes.
My speech.
So positive positive signs can be either 5, 10, or 15 millimeters, depending on who you're dealing with. With the immunocompromised, if they have a 5 millimeter induration, then it would be a positive. If somebody has been in close contact with a person with TB and they have a 10 millimeter induration, that would be a positive. For anybody else, just a regular Joe Smo, it needs to be at least 15 millimeters to be considered a positive PPD. Early stages of tuberculosis are usually symptom-free, but they progress to general feelings of fatigue, malaise, anorexia, night sweats, right, weight loss, and a low-grade fever. Right, you might have a frequent cough with hemoptysis, but that doesn't actually happen until later stages.
If you had hemoptysis, you would get me to a doctor. Hemoptysis means coughing up blood.
Yeah.
If you didn't know.
And you can have a pink frothy sputum,
which is also kind of pulmonary edema, but pink frothy sputum or coughing up blood, emergency room time for real.
Yeah. So on a chest, you look at a chest X-ray for infiltrates. If they had a positive PPD, but a negative chest X-ray, then that means that there's been exposure but they don't have an active tuberculosis
They don't have active
infection.
tuberculosis. Yeah, you can be exposed and not actively suffering from tuberculosis.
Right.
Which is good.
And you give INH. That's the treatment for tuberculosis.
Yeah.
Right?
I don't remember what that stands for, but it's INH. That's the treatment.
I is in like N is in nose, and H is in
heart.
Yeah.
INH.
Yeah.
If you suspect that your patient is non-compliant, you know that they're non-compliant, you have a history of non-compliance, you're going to want them to have directly observed therapy. That is where they go someplace every day and someone watches them take their medication, like a 2-year-old.
Yeah, it's often like the health department, but the reason why is because you have to take this medication daily for 9 months.
And
that's a long time. So that's a lot of time in there to like forget your pill
and develop a multi-drug resistant organism.
Right. That's how actually tuberculosis got so out of control, drug resistant wise as it is, because people can't remember to take their medication every day. I know I would have trouble.
I would probably, I wouldn't want directly observed therapy, but I would need it.
A lot of people do. And in some states, it's mandatory that you get directly observed therapy. So anyways, if they've had the vaccine for tuberculosis, it should not keep you from doing a PPD, because if they've had it as a child, they should still be able to have a regular PPD by the time they're an adult.
The vaccine for tuberculosis is not commonly given in this country.
No.
It's going to be if there's from someplace
But
else.
it is the BCG vaccine, just in case you're wondering.
Yeah.
And the drugs that they give to treat TB, real quick, INH, that's the big one. They give Rifamate, RIFAMATE, high, something. They give streptomycin, and then Ashley's going to tell you the other two because I don't know how to pronounce them.
Pyrazinamide, I would guess, and Myambutol. But INH and Rifamate and streptomycin, those are the big ones, memorable ones. Also, directly observed therapy is really important with TB.
Yeah.